I'm going to record this and put this um, up on Canvas. Anybody have any questions over anything we went over last week? If you do, just you can unmute your mic, and or if you want to just use the chat, whatever. Um, just as a reminder, I believe I'll pull up Canvas here in just a second. 1 second. Make sure everybody's in. I believe you guys have a quiz that's due today. Yeah, I haven't even signed into Canvas yet, so let's just. Oh no, I do. Sorry, my mistake. Yeah, neuron quiz and brain and cranial nerves quiz is due tonight by midnight. Just as a reminder. And lab manual stuff from 13 and 14, which is the brain and neuron structure, and then the brain and cranial nerves. The new stuff I just put on earlier today, and I'll put on some other stuff later. Somewhere, where did I think? Oh yeah. So okay, just a reminder. I think I brought this up to you guys last week, maybe not. For exercise 13 and 14, some things to know. Again, this is just terms and structures that you want to pick out of the exercise 13 and 14 in your lab manual. These are things that are on both these two quizzes, as well as will be on the practical. I remember the practical. Let's go ahead and pull up the schedule and talk about that. Not next week, but I believe the practical is scheduled for the week after next, if I'm not mistaken. So we are at the 9th. Yeah. So being that we were, going to be doing this in the classroom with models and things like that, the models I think are a little bit more of a challenge to get every piece and part. The diagrams are fairly straightforward, I think. So we actually had this week slated for going over the brain and cranial nerves again. So I think what we'll just do is we'll go ahead and start with the spinal cord and spinal nerves and reflexes, and maybe do a kind of refresher next week on everything from basically everything is going to be on this practical, which will be muscle structure, gross anatomy of the muscles, neuron, brain and cranial nerve, spinal cord, spinal nerves, and I'm going to go ahead and throw an exercise 16 reflexes, and we'll talk about that today as well. And then next week on the 16th, we'll just kind of review everything and give you guys a chance to ask questions, things like that. And then the 23rd will be the final practical, and it will basically be like the quizzes. It will be a Canvas quiz, and it will be mostly photos and diagrams labeling things, things like that. So it'll probably be mostly very visual, probably be very similar to what you've had on the quizzes. I don't know if I'll have those exact same diagrams, but expect what you've had on the quizzes lately. So just kind of be aware that's what we're looking at in 2 weeks. So let's go back to what we've got on Canvas for this week. For those of you who do not have the lab manual, and I know there's a couple of you, I went ahead and scanned in exercise 15 and 16 for the lab manual. And I've got a PDF of this PowerPoint that we're going to go over here shortly, the spinal cord and nerves. Again, anything reflex wise we'll talk about will come right out of exercise 16 in the lab manual. So let's go ahead and look at that PowerPoint. And I don't know why that always comes up. Let's see. Okay, somebody give me a thumbs up. Just make sure you're seeing a PowerPoint of spinal cord. Okay, thank you, Mallory. I always like to double check with you guys because, you never know. Sometimes technology eludes me. But let's go down here and we'll do the full screen view. Okay, so that's kind of an interesting view. What we're actually looking at is a slice of a nerve, and all those little guys are these little guys here are the axons, kind of on end. Um, but this is hopefully this should look familiar. This is basically a PowerPoint of just the photos and diagrams out of your lab manual, not lab manual, sorry, the textbook, the lecture textbook, and I took a few out of there, but let's kind of cover some of the stuff that is in your lab manual and some of the important things like structure-wise you guys want to know. Okay, so your spinal cord. Okay, it's not really a cord all the way down. Um, Trying to distinguish, where the medulla stops and the spinal cord starts. Just say at the foramen magnum up here in the skull. Okay, anything outside the foramen magnum is the spinal cord. Anything inside the foramen magnum would be referred to as your medulla. Um, now, you've got 31 pairs of spinal nerves, and how they're named. That is kind of a weird convention. Um, at least when you kind of start to think about it. But okay, so the first pair of nerves exits between the occipital bone and C1. Okay, so in your cervical region, you have nerves that are named. Okay, so the nerves exit above the vertebrae for which they're named in the cervical region. Okay, so you have a nerve C1 exiting above vertebrae C1. You have nerve C2 exiting above vertebrae C2. And that goes down. And so you've got C7 vertebrae. Again, the C7 nerve exits above the C7 vertebrae, but you have a C8 nerve that exits below C7 vertebrae. Okay, so your C8 nerve exits between vertebrae C7 and T1. Should kind of throw you up for a loop a little bit. Okay, you got 7 cervical nerves, sorry, 7 cervical vertebrae, but 8 cervical nerves. So in the cervical region, the nerves exit above their corresponding vertebrae name, and again you've got C8 exits between C7 and T1, and from there on down, the nerves exit below their corresponding vertebrae. Okay, so again, C8 exits below C7, between C7 and T1, and below T1 vertebrae, you have the T1 nerve. Below T2 vertebrae, you have T2 nerve, and from that point on, the nerves exit below their corresponding vertebrae. Okay, just something to kind of be aware of. I do believe that is explained fairly well in your lab manual in exercise 15, but it's just something that if you're not fully aware of, you start looking at the names of these nerves, you're like, something doesn't make sense here. So that's what's going on. But that's all basically due to the fact that you have your first set of nerves exiting between your cervical C1 and your occipital bone. As far as the cord itself, you have 2 thickenings. You have a cervical enlargement, and these thickenings kind of correspond with areas of the plexuses where these nerves exit and kind of coalesce together and form these really intricate arrangements. But you have a cervical enlargement and you have a lumbar enlargement. Okay, it's just a thickening where the cord itself gets a larger diameter. At the end of the cord, you have this conus medullaris, or medullary cone. Some textbooks like to Latinize things a little more, but I believe your textbook does refer to it, yes, as conus medullaris. But it's the end, the distal end of the spinal cord, and it comes down to a cone. Now, from there down, inferior, it's not a solid cord. It's just a bunch of loose nerves. So when and the conus medullaris is about level of T12. So through all your lumbar and your sacral region, it's not a solid cord. It's just loose nerves that are bundled together, kind of like the tail of a horse. So that's where you get the term cauda equina, literally horse's tail. So it's these loose nerves that are kind of bundled together. So when you see lumbar punctures and things like that, they are done in the lumbar region because there's less chance when you stick a needle in between somebody's lumbar vertebrae, it's less chance of doing damage if if you hit these smaller nerves as opposed to puncturing a solid structure like the cord. Okay, the other structure that you see in your lab manual as well is this thing called the filum terminale. That is an extension of the pia mater. And again, the spinal cord is surrounded by the pia mater, arachnoid mater, and dura mater, just like the brain is. Okay, so you've got this same uh, protective meningeal layers around the spinal cord as you do the brain. Why is that not closing? Okay. Wait. Oh, okay. Okay, hang on a second here. Okay, let me just stop my share, go back. Okay, for some reason my PowerPoint was doing weird things with me, so let's just go back and try that again. Okay, screen share and PowerPoint. Let's just do it like this. Okay. Not sure why I was doing that. Okay, anyway. I had it on presentation mode and it wouldn't let me go back to the normal mode. The normal mode, excuse me. Okay, so whatever. Okay, so hopefully you guys are seeing this again, right? Somebody give me a thumbs up. Just make sure you're seeing the spinal cord. Yep, okay, thank you. Okay, so let's see what else is going on here. Again, so beyond T12, it's just this cauda equina, this loose bundle of nerves, and they exit between all the lumbar vertebrae. Again, the sacrum is, you consider that as 5 fused vertebrae, so you've got 5 sacral nerves as well, and you do have a coccygeal nerve that exits at the level of the coccyx. So the spinal cord, where the nerves actually exit, they exit as these little fan-like structures that are referred to as rootlets. So you've got like anywhere between 5 and 6, 7, sometimes, it varies, but you've got a handful of these rootlets that emerge from the cord and then fuse, and then they form what's known as the spinal nerve. Okay, the spinal nerve proper is only about 1 centimeter long. Okay, the spinal nerve is not that long. So if we take a transverse section of the spinal cord, and hopefully this bifurcated spinous process should tell you this is at about the level of a cervical vertebrae. You've got the transverse foramen here, so this should tell you this is a cervical vertebrae without having to read the the heading. But so in the cervical, or the vertebral foramen within the vertebrae, you have a little layer of fat, and then you've got the meningeal layers, you've got the dura mater, arachnoid mater, and again, between the arachnoid and the pia mater is the cerebrospinal fluid. Okay, the pia mater, just like the brain, is very intimately, attached to the surface of the spinal cord. Okay, so kind of taking at the idea of the rootlets, and you've got something like what you see here. So again, you've got about half a dozen rootlets that exit the cord at each spinal level. Okay, and this is like, this is like your C1, C2, C3, whatever. Now you've got, I think your lab manual may refer to them as anterior. I always refer to them as ventral. That's what I knew them as. But you've got ventral rootlets form your ventral root. Then your dorsal rootlets merge to form your dorsal root. And this swelling here that you see in the dorsal root is referred to as the dorsal root ganglion. This one here calls it the posterior root ganglion, whatever, posterior, dorsal, they mean the same thing, but I always learned it as the dorsal root ganglion. Now, what you want to know about the dorsal root versus the ventral root. Okay, dorsal root is incoming sensory nerves. Okay, so they're afferent. The ventral root is efferent, outgoing motor neurons. Okay, because so sensory neurons go in the spinal cord through the dorsal root. Motor neurons take that signal out of the spinal cord through the ventral root. Okay, um, so that plays a role in spinal cord injuries and things like that. So at any given level, if you were to sever your ventral root, okay, you would have sensory from that level because the dorsal root carries the sensory information, but you'd not have motor control over that level. Okay, likewise, if the dorsal root were severed, you would have motor control because your ventral root's still intact, but you would not have sensory in a certain level. Okay, so I want you guys to know that. Know the dorsal root carries sensory information, ventral root carries motor information. Those two quickly merge to form the spinal nerve proper. And again, the spinal nerve really is only about a centimeter or so long before that spinal nerve then branches. It doesn't have it labeled here. I know I'm feeling it's labeled somewhere, but you have um, what's referred to as the dorsal ramus that then turns back and innervates these muscles of the back, these posterior back muscles, and you have the ventral ramus, which is going to form well, depending on where you are, if you're at the level of the cervical or the lumbar enlargements, it'll form plexuses. If you're in the thoracic region, it goes between the two ribs and forms the intercostal nerve. Okay, so we have the dorsal ramus goes to the back, ventral ramus into the front. Um, so we'll kind of get to that in a minute. The other thing I want you to kind of notice here, we'll talk about a little more in depth later, is if you look at the spinal cord, you have a butterfly-like structure. You have the white matter is on the outside and the gray matter is deep. So the gray matter forms this butterfly-like structure. Now, if you remember from the brain, the gray matter is more superficial on the surface of the brain, and the white matter is more deep. Remember, gray matter is neuron cell bodies, dendrites, and unmyelinated axons. The white matter is myelinated axons. So in your spinal cord, the white matter is going to form columns that are basically axons that carry that information up and down the spinal cord. Okay, the gray matter, the deep butterfly of gray matter, holds basically cell bodies and dendrites, things like that. So at the gray matter, you have a posterior horn or a dorsal horn, and you have a lateral horn. Um, Now, the lateral horn in the gray matter is only found in the thoracic region. Okay, um, that is something that's associated with your autonomic nervous system, and it's only found in the thoracic area. The anterior horn, again, I knew that this is dorsal and ventral horns. The anterior horn is this one that sticks a little more anteriorly, the dorsal horn posteriorly, and then you have what's referred to as the gray commissure, which is the bridge across the middle that connects the left and the right halves of these gray matter. The other thing you have is the central canal. Again, this is continuous with the ventricles of the brain, and the central canal holds cerebrospinal fluid. Okay, and then you got, and then your meninges, your pia mater is more attached to the surface. The arachnoid mater houses the cerebrospinal fluid, and then the more thickened dura mater is superficial to that. Now, I will not make you know these tracks, okay? You can look through them, but basically, I wanted you to know this just to appreciate the fact that, again, in the white matter that you have, the white columns that you have surrounding that gray matter butterfly, certain information is carried in certain areas. Okay, so the ascending tracks are in red here, and again, they're bilateral. Okay, they just show the ascending on one side and the descending on the other side, but these, both these red and green are bilateral structures. Okay, don't think that for one second that the sensory is just carried on one half of the spinal cord. But the ascending tracts is your sensory tracts, and that's information carried up to the brain. And again, what they refer to as columns So your gray matter is divided into horns. Okay, so there's your ventral horn, dorsal horn, and you can kind of think of that as dividing the white matter into columns. So you've got ventral columns here, lateral columns over here, dorsal columns back here. Again, left and right. These are bilateral. So for the most part, if you're having like spinal surgery, and they're doing it as if it's mostly posterior, they're going to run traces on your senses and make sure that the posterior tracts, these ascending sensory tracts, are functioning properly. If you're having um, surgery in the ventral part of the spinal cord, these are all motor tracts. These are descending tracts carrying motor information down to the body from the brain. So they're going to do a different type of uh, of test. Um, if we would have had this in lecture, when I used to lecture in anatomy, I used to cover this. But for a brief period of time, I worked a very interesting job. It was called intraoperative neural monitoring, and basically, so I would, when a surgeon was going to do this type of surgery, I would go in and monitor these tracks on the spinal cord. So if we were doing sensory tracks, I would hook electrodes up to somebody's wrists and ankles, and then another set of electrodes to the brain, and I would stimulate the nerves in this ascending tract, and I would read the nerves as they received by the brain. And if those traces started to fade, I could tell the surgeon, hey, I'm starting to lose signal here, and they would move around their hardware or whatever. And oftentimes, the surgeons can, with the clamps and things, they would pinch off blood supply to certain parts of the spinal cord and not know it. A big risk of spinal surgery is waking up paralyzed because it's the surgeons can't always tell when they're cutting off blood supply. And likewise, we do the same thing if they were doing anterior surgery, like they're putting in hardware for scoliosis or something like that. We would do the opposite. We would stimulate the brain, we would stimulate the motor tracts, and we would see muscle twitches down in the legs and in the arms. Okay, we would stimulate some of these tracts just to make sure that they were functioning during surgery. Kind of an interesting set of careers that I used to talk about, but uh, I certainly would not expect you guys to know the names of all these tracks. Okay, what I would expect you to know is that there are ascending tracks that carry sensory information to the brain, and there are descending tracks carrying motor information from the brain to the body. Okay, when you guys get into med school and stuff later on, you're gonna have to know all these, but I'm not gonna make you know that. Just be aware they're there. This next couple of slides, again, I won't ask you specifics, but I do want you to understand that somewhere in the medulla is where the motor and sensory information crosses over, from the left side of the body to the right side of the body and vice versa. Okay. Um, so there is a crossing over. So the left side of the brain controls the right side of the body, as well as gets sensory information from the right side of the body. So just, kind of be aware of that. So that was sensory, and here's motor. Again, in the between the medulla and the spinal cord, where the what they call the decussation in the medulla is where they split, or sorry, not split, but they verge from one side of the body to the other. Again, I won't ask details about those couple of slides. I just want you to be aware that there is a switch from one side of the body in both sensory and motor. Now, I don't think this is actually in your laboratory manual, um, but I want you guys to know, just like there was with muscle, if you remember, we had the epimysium, paramysium, endomysium. You have that same type of arrangement of connective tissue in the nerves as well. So if you go down on the very small level, you've got the single axon here. Outside the myelin sheath, outside the Schwann cells, you have the endoneurium. All right, it surrounds the individual axon. Axons are bundled into fascicles, and around each fascicle, you have the perineurium, and around the whole nerve itself, you have the epineurium. Okay, and then nerves need blood as well. So if you really dissect and look under a microscope, you'll see these really tiny microscopic blood vessels within a nerve. And this is a nerve to the eye is sometimes as thin as a thread. I mean, they don't really look that big, but you do have microscopic blood vessels and all this within the nerve. So just, be aware of that arrangement and know that it exists, and be able to tell me which is more superficial. Remember, epi is, as a prefix, it means upon. So the epi, whatever, is usually the outermost. As opposed to peri or endo. All right, endo is in. You should know endo is the deepest of the layers. Again, there's various ways of classifying nerve fibers. Again, I just kind of threw this in there so you'd be aware. Afferent carries signals to the CNS. Efferent carries signals away from the CNS. So afferent is sensory, efferent is motor. Somatic innervates skin, skeletal muscle, bones, and joints, usually things that you can control or you can sense. Visceral fibers innervate blood vessels, glands, and viscera. All right, the viscera, your guts, your organs, the abdomen. Visceral fibers, usually you don't control things like that. The visceral fibers are going to be like your autonomic nervous system. Okay, you can't control your heart rate, you can't control the diameter of your blood vessels. Okay, that's just something that your brain does on its own that you have no control over. Somatic fibers you can sense and you can control. Okay, you sense what's going on in your skin, you control your skeletal muscles, things like that. Again, general and special, that's kind of a generic definition, but I think you should know afferent versus efferent and somatic versus visceral. Okay, a little closer look at what's going on with the ventral and dorsal roots. So again, we got your ventral root carrying motor information out to the body. Your dorsal root carries sensory information from the body to the CNS. So this posterior root ganglion or dorsal root ganglion is swelling. Now, a collection of neuron cell bodies within the central nervous system is called a nucleus. Um, Probably in lecture you've talked about the different nuclei within the brain, or within the brain stem. These are different collections of cell bodies that control heart rate, phase of constriction, phase of dilation, breathing rate, things like that. Outside the central nervous system, and again, this is a nerve, this is outside the spinal cord, so technically as soon as you leave the spinal cord to these rootlets, you are outside the central nervous system and now in the peripheral nervous system. But in the peripheral nervous system, a collection of neuron cell bodies is referred to as a ganglion. So this is what you have in these dorsal root ganglions. And hopefully you remember this neuron shape. Remember, this is pseudo-unipolar. So let's say you sense something in your skin. Okay, you're reading braille. Okay, let's say somebody's blind and they're sensing something in their fingertips. That incoming information comes in through these. Um, Technically, they're dendrites because they are afferent to the neuron, but they're really long dendrites. Okay, these pseudo-unipolar neurons are a situation where the dendrites are between the length of from the tip of your finger all the way to your spinal cord. Okay, and these are the cell bodies for those sensory neurons that sense things out in your periphery. Okay, so the cell bodies of these sensory neurons lie within that ganglion, and that's why you see a swelling there, because you've got all these cell bodies. The dendrites for those make up this nerve here, this afferent sensory nerve. Okay, and then from this point on into the spinal cord, you have the axons. So this is these pseudo-unipolar neurons are a unique situation where the dendrites are long and skinny and usually longer than the axons. So the axons just carry that information into the spinal cord, and usually they synapse with another neuron that'll carry that signal up to the brain. So that's what you're looking at in the posterior root ganglion. Okay, these pseudo-unipolar cell bodies. And then that merges with the outgoing motor nerve fibers into the spinal nerve. So a spinal nerve is mixed. Okay, it is both motor and sensory. All right, at the point where you've got your dorsal root ganglion, that is purely sensory. The dorsal rootlets are sensory, and again, the ventral rootlets are motor. The ventral root, where the root that's merged, is motor, but once they get to the area of the spinal nerve, remember that is mixed. That is both motor and sensory. Okay, so what you're looking at again here is a blow up of that area there. So again, posterior root sensory, anterior root is motor. All right. Let's see. I don't really think I need to go over this one. This is more of a kind of just a, let's see what I've got. Intermediate sensory. I don't know what intermediate is. Was there an intermediate sensory somewhere? I don't know what that means.
Isn't intermediate sensory in the central nervous system between the CNS and the PNS that connects both the sensory neurons and the motor neurons?
Oh, the interneuron. What you're thinking of is kind of like the interneuron, right? Mm, we'll talk about the interneuron. The interneuron really is just a neuron located within the central nervous system. Now, okay, that diagram, I know what diagram you're talking about now. That diagram with the sensory neuron going into the central nervous system, the interneuron that was like within the cord, and then the motor neuron leaving it. The interneuron, okay, so that's when we get to reflexes, we'll talk about that again. That's just a very simple pathway, basically. Now, usually you'll if it's something you sense and you perceive, that signal will be carried up through the central nervous system by an interneuron. Like an interneuron is basically just a neuron between the sensory, between a sensory neuron and between a motor neuron, and it's just located within the central nervous system. Yeah, okay, now I get what you're saying. Yeah, we'll kind of visit that in a little bit when we talk about reflexes. Yeah. Now, as far as this one, again, um, I will have you know the plexi. I'm not up with my Latin, but I think it would technically be probably plexi. Um, when you talk about the plexuses, I want you to know the ranges, okay? And there's only one little bit of overlap. C5 is in the cervical plexus and the brachial plexus, okay? In the next few slides, there's some that kind of talk about what nerves are in those. The other thing I might ask you, so I would make it easier. I would give you the more elaborate thing. I would tell you, okay, C1 to C5, what plexus is that? Or C5 to T1, what plexus is that? I wouldn't make you come up with the range, but I would give you the range and ask you the plexus, okay? So when we're talking about these individual spinal nerves as they leave, remember we've got C1 to C8, and remember C8 leaves, exits underneath the C7 vertebrae and over top of the T1 vertebrae. Okay, so from T1 up, remember they're named from, the nerves are named by the vertebrae they exit over, and from T1 down, they exit under their corresponding vertebrae. So the plexuses are formed from your cervical region, and again, T1 has got a contributor to it. T1 to T12, these nerves, as they leave, they just go out to the intercostal muscles between the ribs. The lumbar plexus is your L1 to L4, and you'll see some textbooks that throw the they'll call it the lumbosacral plexus. So they'll throw basically L1 to S4 in together as one plexus. And there is a little bit of overlap in some of these plexi, of course, so don't worry too much about that, but just have feel that yes, you've got plexi, and basically I feel like the plexi correspond to the limbs. So the cervical plexus, the brachial plexus, they mostly go out to especially the brachial to the upper limbs, lumbar and sacral plexus down to the lower limbs. I would not ask you about the coccygeal plexus. That again is minor, and we're just not going to concern about. I think we've got enough with the cervical, brachial, lumbar, and sacral plexi. Okay, so what I kind of alluded to earlier, um, so again, kind of having a feel for like what branches and everything you have for the nerve. So this is a typical thoracic level spinal cord. And again, you've got the dorsal rootlets form the dorsal root ganglion that merges with the ventral rootlets, ventral root, and makes the spinal nerve proper here for about a centimeter or so. Then the spinal nerve branches. You've got this very thick, very larger anterior ramus. The posterior ramus again goes back and innervates the muscles of the back and anything posterior to the skin as well, posterior to the vertebrae. Um, Now, this uh, communicating ramus. I don't know if your lab manual. I don't think the lab manual actually mentions the communicating. Yeah, it does. Okay, on page 184 in your lab manual, um, you have it. Now, again, some books Latinize it a little bit more. Your lab manual calls it the rami communicantes, um, communicating ramus. Okay. Um, Either or, it's the same thing. But the communicating ramus is something, again, you only see at the thoracic level, and that center, and that communicates with the sympathetic ganglion. The sympathetic ganglion just is, it kind of sounds like, controls the sympathetic nervous system, your fight or flight. So that is a chain. There's a what they refer to as a ganglion chain. Basically, all the levels of the thoracic vertebrae have a ganglion at each level, and they both connect to the anterior ramus, and they connect to each other up and down through a nerve plexus as well. So just know that the sympathetic ganglion you find within the thoracic trunk, and these guys control your sympathetic nervous system. So they control the respiratory rate, heart rate. Uh, when the sympathetic nervous system activates, you are not digesting, and you're not producing urine, so it kind of has control over a lot of different things within the abdomen. So just kind of be aware of that. The communicating ramus communicates between what you think of more as your somatic nervous system, which you can control. Okay, that's most of the anterior ramus is going to go out to skeletal muscle and things like that, or receive from sensory information that you actually feel. But that communicating ramus is kind of a communication between your somatic nervous system and your autonomic, your visceral nervous system. So that's the two branches, or sorry, three branches or rami you want to know: the anterior ramus, uh, posterior ramus, and the rami communicantes, or communicating ramus. So again, it's this anterior ramus that forms the plexi. Okay, the dorsal ramus just goes to the deep muscles of the back and the muscles of the skin of the back. The plexi that you're looking at here, the cervical, brachial plexus, lumbar plexus, sacral plexus, those are all formed from the anterior ramus. Okay, so it's the anterior. That's why it's thicker too. I mean, you think there's probably a lot more axons in this anterior ramus than there is in the posterior ramus. So, or dorsal ramus, whatever. I always know it as ventral and dorsal, but you see some textbooks that use different terminology. Again, I used to like dissecting cats because you'd actually see these little rootlets as they leave the spinal cord. Um, but you see how the rootlets form the root, and the dorsal root ganglion, just like a little swelling. Again, you've got to have a little bit of a wider area though to pack all those cell bodies in. Uh, Yeah, there we go. So here's the sympathetic chain. So what we looked at is just a transverse section earlier. You see kind of more in a real three-dimensional structure. So you've got your spinal nerve, you've got your ventral ramus, you've got your dorsal ramus, your rami communicantes that can connect to the sympathetic ganglion. And again, each of those ganglion attach to each other up and down, as well as at each level. So they form kind of a chain up and down the thoracic thoracic vertebrae. And again, at the level of the thorax, the thoracic vertebrae level, this anterior ramus goes out and forms the intercostal nerve. Okay, so it innervates the intercostal muscles as well as receives sensory information from the corresponding skin. So with the plexi, um, the the thing I want you to know with the plexi are both the spinal cord nerve levels, okay, C1 to C5 for the cervical plexus, and the other thing I might ask you is the is a nerve that goes in this plexus. And again, I would give you the nerve name. You tell me that the plexus that it goes into. And again, a lot of these nerves, if you just look at the names of them, they'll tell you something about it. The big important one in the cervical plexus is the phrenic nerve, innervates the diaphragm. Okay, so if you break your neck and you sever this phrenic nerve, your diaphragm is not breathing. Okay, so you can basically suffocate from breaking your neck if you sever this phrenic nerve. Okay, that's the important one. This ansus cervicalis, it's kind of interesting in a way that I don't know. It's kind of used as I guess an argument against intelligent design and things like that, because if you look at a structure of, I think it's the giraffe, there's a video out there with where they dissect a giraffe neck and they find this nerve, and this nerve passes all the way down the giraffe's neck, then turns and passes all the way back up, and it's this nerve that they use. It's just useless trivia type thing, but that's this ansa cervicalis, is this loop in this cervical nerve. I don't know, I just found that interesting. But the big thing about the cervical plexus is the phrenic nerve. With your and again, just know the levels. Okay, when we get to things like the brachial plexus, you don't need to know the roots versus the trunks versus the divisions. Okay, but all you really, all what you want to take out of this is the fact that these guys merge, split, merge again, split again. Okay, so there's a lot of intercommunication. So if you look at like each of these nerves, like they split, they merge with other nerves, they split again. So there's a lot of, it's a network, and there's basically just a lot of splitting and fusing and resplitting again, I guess. But it just, again, if I gave you some of these nerves, most of these are in the arm, and you should look at the name and be able to tell. Ulnar nerve. Oh, gee, I bet that runs next to the ulna. Radial nerve. Yes, it runs on the radial side. Axillary nerve goes to the axilla, controls the deltoid muscle. Musculocutaneous. Okay, muscle, cutaneous, skin. So there's a lot of, a fair amount of sensory there. But just kind of know, again, if I gave you these nerves, be able to tell me what plexus they belong to. Okay, the ulnar nerve, that is the one on you hit on your funny bone. All right, if you hit the medial side of your elbow and you make that tingle, that is the ulnar nerve, and that tingling, if you do it enough, you should feel that down the medial side of your arm and into your pinky and your ring finger, because that's where it innervates. Okay, the radial nerve innervates the thumb and the index finger in the middle. So, that's, again, just be able to tell me what plexus those nerves belong to. And again, just a little bit more. I wouldn't ask you all this detail, but it's there. It was in the PowerPoint. I just thought I'd show it to you. And here's a dissection of it as well. Again, just more than you need to know. But if you get the lumbar plexus, a lot of these nerves are named for structures around there. Ilioinguinal. All right, the inguinal region is they think of like an inguinal hernia. The inguinal region is kind of an equivalent to the axillary region of the armpit of the lower limbs. It's a soft area anterior where you can feel it, the inguinal pulse, and the nerve goes over there as well. So a lot of these, go down the leg, of course, innervate different muscles, things like that. And just again, if I gave you the nerve, be able to tell me what plexus that nerve belongs to. Sacral plexus, again, the big one you've got out of here is your tibial nerve and your fibular nerve. These guys form the sciatic. The tibial nerve and common fibular together form the sciatic nerve. And again, useless trivia stuff. This is the largest nerve in the body. Some people can still consider it two nerves. Technically, it's two nerves contained within the same sheath. So, if it gets pinched, they're often pinched together. Um, but whatever. The sciatic nerve is kind of an antiquated name, but it's still stuck with it. So again, not only talking about innervation of the muscles, the lower limb, but the genitals as well. The pudendal nerve. Pudendum comes from Latin. Latin root is pudere, and I think literally it's like shameful or something like that. That's your shameful parts, your dirty parts, your naughty bits, whatever. But the pudendal nerve innervates the genitals, and that comes out of your sacral plexus as well. This is not in your lab manual, but I think you should just kind of be aware of what dermatomes are. Um, Dermatomes are strips of skin that are innervated by particular nerves. So if you notice, like your cervical nerves go down, start off with your face, a little bit of lower face. Again, most of the sensor, the bigger part of the face is the facial cranial nerve. C5 and T1 goes down to the bit of the medial part of the arm, but you're looking like most of your cervical innervates the arm and the hand. So this is all sensory. Okay, so if you're looking to determine where somebody has a spinal cord break or something like that, you would poke them with an object and try to determine at what level that break is. Okay, so this is like telling you what part of your skin, what part of the sensory information from that skin strip goes to what level. So again, your sacrum is the genitals. It doesn't show the back, but the sensory, the coccygeal nerve is right around the anus. But we've got again S1, S2, S3. S4 and 5 is on the post here as well. It doesn't show it on this diagram, but just understand what a dermatome, what dermatomes are. And I'm sure there's a little bit more elaborate in your lecture manual, your lecture textbook, but it was there. I just thought I'd talk about it. Okay, so some kind of quick and dirty reflexes, and again, we'll talk about reflexes a little bit more next week. We're kind of pushing. I know an hour is getting to pushing what we want to do in lecture, but here is your simplest reflex, and it is what they refer to as a monosynaptic reflex. So if you remember the interneuron that we talked about that's contained within the spinal cord, this actually does not have an interneuron. There is a sensory neuron that carries that information in the cord, and it synapses directly with a motor neuron that leaves through the ventral root and causes that muscle to shorten. So what this is our patellar tendon reflex, and I'm sure you can do this actually on your own if you have your leg kind of hanging off and you feel the bony part of your patella and go just a little bit below that. There's the bony patella and then the bony tibial tuberosity. If you tap that patellar ligament, your quadriceps muscles will contract and they'll kick your foot out. So what this is that tapping is a very quick stretching of that ligament, and basically your body senses, okay, if a ligament is stretching, then I need to contract that muscle in order to prevent injury, because obviously if a ligament's stretching, it's you're extending or flexing in a way that could potentially injure your body, and you respond to that without even thinking about it. So again, kind of diagrammatically, you've got these sensory neurons out in your body. And again, you've got this really long dendrite that looks like an axon, okay, just like a long singular dendrite because it is incoming. Your cell body to that pseudounipolar axon is within the dorsal root ganglion. The short, I said cell body, that neuron, not axon. The short axon of that goes to the gray matter of the spinal cord and innervates with the motor neuron and carries out to the ventral root and causes that quadricep muscle to contract in response to that stretch. And that right there, that patellar reflex is one of your simplest, what's referred to as a monosynaptic reflex. You only have one synapse. Okay, others have interneurons, but this one is one of the simplest. And I believe we're going to cut it there today. I'll talk about the other stuff, and we'll actually hit reflexes next week. Let's just cut it there for today. So look for a quiz. I'll probably put one up in the next day or two and make it due by next week. And maybe I'll do an assignment as well for the review sheet, the material at the end of exercise 15. And again, with these review sheets, I'll make it worth your while. I'll make it a quiz grade, so it's not just busy work. So just kind of a reminder. Let's go back to Chrome. Neuron quiz due today, as well as brain and cranial nerve quiz. And again, I don't care if you guys sit with your lab manual in front of you. You should be able to do reasonably well on these. They're just basically identifying things, different types of neurons. We talked about the pseudounipolar a lot today. And the other thing is that exercise 13, 14 in your lab manual assignment. Again, I know there's some that are like drawings in there. Just do the ones that you can kind of easily correlate or easily translate into a Word document. Okay. Again, I've got PDFs of the lab manual if you don't have for exercise 15. So be on the lookout today for a quiz for what we talked about with the spinal cord, as well as an assignment for the review sheet on page 187 and 188. It's only 2 pages, but the review sheet for the end of exercise 15. And next week we'll go over the reflexes. It's really brief. We'll go over the reflexes and review for muscles, brain, cranial nerves, and the spinal cord. Yeah, so let's just do that. Okay, if you guys have any questions, I will hang out. But again, you guys are dismissed. Go ahead and log on.